Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. Our guest in studio today is Mr. Stephen Powell, the CEO and president of Synensis. He's an international patient safety culture expert and a recognized safety and quality leader who leverages the power of safety culture to drive results, develop high reliability teams, accelerate quality improvement, and reduce medical errors. And he's here with us to talk about his book, The Patient Survival Handbook, and also to give us a little insight into his company, Synensis, and how they help hospitals achieve zero preventable errors. How are you doing today, Stephen?
I'm doing great, Neal. Thanks for having me today.
Now, you've co-authored a book called The Patient Survival Handbook. Could you talk a little bit about the Patient Survival Handbook, why you wrote the book, and some of the ways that the book helps patients to identify when a lack of communication is affecting their particular healthcare case?
Thanks, Neal. Yeah, I'd be happy to. The handbook, the Patient Survival Handbook, really is the genesis for this book was really to try to turn the tides a little bit. For the last decade, our company, Synensis, has really been working directly with the healthcare professional, everybody from senior leaders in hospitals, clinics, and health facilities around the U.S. and the world, for that matter, really try to tackle this issue of preventable patient harm. And in that work, it's kind of obvious, Neal, that we were missing a very important member of the care team, and that's the patient and the family themselves. Mm-hmm. If we were going to try to make significant reductions in these harm numbers, we believe that as many as 400,000 Americans die each year as a result of medical errors, preventable medical errors. And that makes it the third leading cause of death in the United States. And we actually think that these numbers may be similar, not the numbers themselves, but the third leading cause may be similar in other countries as well.
In your experience, when we're talking about these preventable medical errors and 400,000 people on average dying each year, are we talking about things that result in identifiable harm immediately? Or are we going and saying, 10 years down the line, a mistake was made and it's just being discovered? Are we putting those numbers together, or is there some type of separation when we're doing research?
Yeah, this is an annual number. And this data is gleaned from from samples of medical records that are sampled and looked at. And there's some scientific ways that we go about using this. There's a tool that we've now begun to use, and we're using technology to grasp this. What an error really is that this is something we've intended to occur, and it did. So it could be an error of omission or an error of commission. And so this could be something as simple as, that we gave someone the wrong medication. It could be that it's meant for another patient, but it was mistakenly given to the wrong patient. It could be the fact that we see this in the news more often, that the actual wrong site is actually operated on. This actually happens 10 times a week in our country. The wrong body part is operated on inadvertently. 10 times a week, we actually operate on the wrong body part site. This could be the wrong finger. This could be the wrong leg. This could be the wrong arm. So this is a very, very difficult. It could be the wrong tooth if it's an oral surgery. Mm-hmm. So these things are happening each and every week in our country. It could be that these are even more serious. It could be that there's an operation occurs and we leave an object behind in the chest cavity or in the abdominal area. This is specifically there's a lot of these incidents that occur with obstetric cases and gynecological surgeries where things are left behind basically, and then discovered later after an infection is the culprit that sort of generates interest in looking back at the site, find that maybe something's been left behind. These are tragic things that occur, and some in our country are coining these as never events. So they should never happen. but they're happening still at alarming rates based on what we would know as high reliability organizations. So that this is still, too high for the number of cases that get done in our country every year.
Now, what about these healthcare facilities that cater to the elderly? Are we talking about simply hospitals and surgeries, or are we including things that happen in nursing homes, in hospice, things of that nature?
So this data, these numbers are really coming from inpatient settings, which would be hospital-based settings. We really don't know fully what's going on outside of the hospital setting. Most of this data is from the inpatient or hospital setting. So places like we would say clinics, your doctor's office, diagnostic centers, even the skilled nursing and nursing home arena. We just really don't know how bad the problem is out there. So we're sure that there almost 70% of care actually occurs outside a hospital. So there is a likelihood that this number could be actually much higher if you include those other settings.
So what types of questions should we ask? I mean, we trust our doctors, our specialists, to know what they're doing. They've been to school, they're making, all the money, and they're supposed to know exactly what they're doing. What types of questions do we ask to make sure that everybody's on the same page? And how do we ask those questions to someone that's so knowledgeable as far as we're concerned?
Well, I think what you hit the nail on the head, Neal. Really, the first thing is start asking questions, really. And that's really how does your hospital, for instance, or your nursing facility, how do they rate against other facilities in your town, your community, your city? And you can do that very simply. You can make if you ask that question, there's resources available. One site that is fantastic, we talked about in the book, to help you start to think about this is hospitalcompare.gov, which is from the Center for Medicaid and Medicare Services. And you can put your zip code in on that website and look at facilities around your radius area, and they have side-by-side comparisons of their safety and quality records. So that's one way that you can do some homework. You definitely can start asking questions about safety with your doctor, your nurse, your provider, your healthcare professional, which is how can you become more involved on the patient safety team? What can I do to help improve my likelihood that I'm not going to suffer a medical error? So something as simple as making sure that people are checking your identification bracelet every time, each and every time before, and asking you to verbally assert who you are and what your date of birth is so that you can be solidly recognized as the right patient before you're ever going to receive a medication. That's a great question, though, is to ask more questions. And those come from becoming more informed about the problem and where I'm likely to run into some of my riskiest situations while I'm in a hospital. And one of those situations where it's really risky for you is when you leave a hospital and not fully understand what you're supposed to do now that you've left the hospital and you've been discharged, and you need to continue to convalesce. And do you have the proper support to help you do that? And then do you fully understand the instructions that you've been given? And also, are you able to get the medications that you are required for you? And sort of continuing to ask those questions is what would bring me back to the hospital? What sort of things should I be looking for as a patient or as a family member of a patient that would signal me that maybe I'm getting an infection from the surgery that I just had, and getting that infection dealt with before it could become a serious problem and lead to a monumental case of sepsis or some other hospital-acquired infection activity. So anyway, those are the kinds of things. And when you say about questions, and the book's full of questions, that's the key. Where you are in any setting that you find yourself from a healthcare perspective, there are lists of questions that you can ask of your healthcare professional to become more informed as a patient.
Now, where can we get a copy of the Patient Survival Handbook?
Well, you can go online, www.patientsurvivalhandbook.com. You can also just go to Amazon and put in Patient Survival Handbook, and it'll pop up on Amazon as well. And they have the electronic version, which is awesome because then you can just put it right on your mobile device and have that available to you, when you need it. That's probably the way this book will be used as a tool when you need it, either for yourself or a family member. And I think anyone who's what we've seen is that moms are generally the leaders on the healthcare team from a home standpoint. They finding this to be a very valuable resource for them and their families.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. It's been a pleasure speaking in studio today with Mr. Stephen Powell, the CEO and president of Synensis, and also the co-author of the Patient Survival Handbook. We've been here in studio today talking about some of the ways that patients can be more proactive and begin to ask questions, very important questions that can go a long way into keeping yourself safe when you're under the care of a doctor during hospitalization and after you go home. It's been great talking with you today, Stephen.
Thanks, Neal, and thanks for the opportunity to talk with you and your audience as well.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.